It's time to tune in for Cheri Senior Moments on WRMN AM 1410. Airing every second Thursday of the month from 9:05 to 10 a.m. This is the show dedicated to helping seniors in the Fox River Valley make the most of their golden years. Your host, Sherry Aschenbrenner, brings you valuable information, resources, and helpful insights designed especially for seniors and their families. Call into the studio for any questions you might have for Cheri and her guests at 847-931-1410. You can tune in on WRMN AM 1410, listen on the WRMN app, or watch us live on youtube.com/WRMN radio. Grab a cup of coffee, get comfortable, and let's get started with Cheri's Senior Moments.
Hey, good morning, everybody. Yes, it is Cheri's Senior Moments right here. We have Cheri Aschenbrenner, and that guest she has today is Heather Detterman. So, Cheri, go ahead. Take over, man. This is you.
This is it, Cheri Senior Moments. Okay. Yeah, I do have a guest today, but I'm going to make a few announcements first. As always, we have some upcoming events for seniors. And the first one is going to be the Elgin Township Triad. Next Thursday, a week from today, they're going to have an event down at Senior Services. They're going to host it there at 205 Fulton in Elgin. They're going to have a speaker of Dr. Michael Hernandez and a nurse practitioner. It starts at 10 a.m. Talking about some weight loss and strategies to build some new routines and food modifications. And they'll talk from 10 to 11. And then at 11 o'clock, we have speaker Taylor Spooner. She's an attorney in Elgin, or South Elgin. I had her on my show a few weeks ago. I think it was, maybe a couple months ago. She's going to talk about practicing in the area of the estate planning and wills and trusts and making sure you got your powers of attorney. Then you guys, if you come, you get a free lunch, complimentary lunch from Cafe Roma, sponsored by Elgin Township Triad. So if you want to go, again, it is next Thursday at Senior Services, but you need to really call today. I think that today might be the ending date for RSVPing. And you call Elgin Township at 847-741-2045. Again, 847-741-2045. So my guest is the secretary of Elgin Township Triad.
And I'll be there.
Yep. So I've known Heather a long time. So she's part of the Triad and as well as the dementia-friendly Elgin area. So, okay, next thing. Sometimes people say, I wonder if I'm getting dementia. I forgot what I was going in the room for or whatever. We're going to have a free memory screening, and it's going to be held at the Gailboard Library, the main library, Thursday, September 3rd. It's going to be so simple. It's between 2:30 and 5:30. You just go. You don't need an appointment. We got people there that's going to be giving those tests from Ascension, and they take you into a private room for 15 minutes, and they'll give you a screening test. It's very private. You don't have to give them any information. It's just for your own knowing, I should say. It's not going to be kept in a computer. There's no fee. We don't need any insurance information. It's just you come, you take the little test, and I think it just gives you a little maybe sense of peace of mind of what's going on in case you're considering, you're just kind of worried about maybe your memory. So again, that's September 3rd, 2:30 to 5:30. Just head over to the Gailboard Library. It's going to be in English and Spanish, so we'll have people there that can speak Spanish for you as well. People have loved it. We've done it two times before. This is our third time. And
It's a good baseline for your doctors, too, to know kind of where you're starting at.
Yep, and I think we had 40 the first time and over 60 the second time. So, we get through it. It's quick. It's 15 minutes. We had our Elgin Area Memory Cafe a couple days ago. That was insanely fun. Yeah. We had a bean auction, and we had about 45 people there. We meet the second Tuesday of every month. We meet at the South Elgin Public Works Building between McLean and Route 31, 1000 Bowes Road. And from 4 to 5:30, we usually start out with some pizza and then usually a guest speaker. Always something senior-related or dementia-related. So you learn a lot. You get so many resources there. Our advisory council members are there. It's it's worth going to and checking out if you think you need some resources, or just where do you start. So again, our next one will be September 8th, and we're going to have Operation Sweet Life. Diane is going to come and talk about how they assist veterans by providing some used furnishings. They have a warehouse at 1600 Todd Farm Drive in Elgin, in case you didn't know. And that all that goes for support to veterans and helping them get set up, in their home. Next is, I want to make sure that if you want to get on my email list for Dementia Friendly Elgin, you should. I think I have 350 names now. I'm happy to take your name. All this information gets sent to you maybe once or twice a week. It's so simple. All you got to do is email me or call me. And if you want to call me, it's 847-468-4168. 847-468-4168. Call me. I'll get you on the list, and then you'll have all this information. My show is next month, September 10th, and I'm going to have someone come on from the Alzheimer's Association, because we're going to discuss the Alzheimer's Walk and some personal stories and some resources that are available for you. Okay, and then last.
And Cheri doesn't sell your information.
Oh, no.
She doesn't share your information.
I do not.
And she's the best person if you have any questions to reach out to, because she knows all of us.
25 years we've been doing this, so if you need, like I said, my story is, and my motto is, I might not know everything, but I do know people that, know something. So We'll get you to somebody. We don't tell you I don't know. You're never going to hear that. And last, if you are a senior citizen, you have a pet, the Kane County Animal Control, they have a rabies vaccine clinic. They just had one on August 8th. So now the next one is September 16th, Wednesday, September 16th, 4:30 to 7. And they're in Geneva. They're at 4060 Kenslinger Road. That's the Kane County Animal Control. Wednesday, September 16th. If you take your pet there between 4:30 and 7, and you're a senior citizen, you can get the rabies shot for $30 and a microchip for $15. And you don't even have to get out of your car. You just go into the parking lot, and they're out there helping you. Again, any questions on any of this, you just need to call me, and I'm always happy to help. But I have Heather here today. She is with Comfort Keepers. Like I said, I've known Heather for quite a long time, because, again, we've been on Triad together for years, and she's also on our Dementia Friendly Elgin Council, too. And so she was talking the other day about this program called GUIDE, G-U-I-D-E. And I said, you need to come on the show and tell people what this is, because it's new, right? It's newer. And what does it stand for, and what is it? So Heather, introduce yourself and let us know what you do and how you got into your role.
Yeah, so I am Heather Detterman. I'm the client care manager with Comfort Keepers. We're a home care agency. We send out caregivers to help people age in place or recover after surgery in their home. I am a certified dementia practitioner and a dementia connection specialist and a CNA. So I've been in this industry for a long time, since I was about 17, working in a skilled nursing facility and being a caregiver myself and caring for loved ones. It all started with my great-grandma, who was my babysitter. Mm-hmm. And she lived through the Depression, so I could wash my underwear in the sink, and I could live off of non-perishable food items and expired food items. But she was my girl. She was my golden girl. So that's where my love.
She was your inspiration, huh?
She was.
Yeah.
That's where my love for the seniors came from, and I'll be one probably sooner than later, if I'm lucky. But yeah, dementia care is what we're here to talk about.
Right.
And dementia care is changing. Right, I would say 40 years ago, they used to just stick somebody in a asylum and say you were crazy, and that was that.
Or senile.
Yeah, senile, that was the word.
Hardening of the arteries.
Yes.
Yeah.
But it turns out that there is a disease progression in the brain, not caused by dementia, but dementia is the symptom. So it could come from Alzheimer's, it could come from Parkinson's, vascular changes, but basically the brain is shrinking. Mm-hmm. And more people are getting diagnosed earlier now, which is great, because there are lifestyle changes you could make Again, there's no cure for it, but you can prolong your life in a better way. And now hospitals, social workers, nurses, home caregivers, we're all trying to collaborate for a holistic, whole person-centered approach. And the healthcare systems are realizing that not only the patient needs help, but the caregiver. So if your mom has dementia, if your husband has dementia, you are just as affected by the disease as your loved one, if not more. Wouldn't you say so, Cheri?
I would say so, yes. It is very exhausting.
More
Yes.
than 7 million Americans currently have a dementia diagnosis, and that's only the ones that have been diagnosed. I run into people living alone. I get a call from Adult Protective Services. They need help. I go there, and clearly they're not paying their bills. They don't have any adult children to care for them. They're not going to the doctor, taking their medication, and they're alone, and that's really scary. But the caregivers who are involved, so if this is your loved one living with dementia, you are living with dementia too. You have stress, depression, burnout. They notice that the caregivers are suffering higher stress levels, chronic inflammation, physical illness. And what happens if you pass away before your loved one?
Right.
Your whole life is built around
Plus
them.
your income. You know, you got to think too, your savings that you're using to take care of the person,
Yeah.
you know, with people coming in, and if you're keeping them at home, and how expensive it is to put them in a memory care.
Yep. And if you do want to go to memory care, you have to drain all your savings, and then your spouse is left with nothing when you're gone. So it is a challenge. Medicare is starting to notice a little bit, which is better than it's been. Typically, Medicare would pay for home health services if you were discharged from a rehab. That's where a nurse would come out for an hour a week, check on your medications, maybe provide some physical therapy, occupational therapy for X amount of days, whatever was approved by insurance. But everything else was on that caregiver's plate. So cleaning the house, bathing your loved one, changing their clothes, taking them to appointments,
Right.
meals, and then the quite so frequent ER visits that
Yes.
they just got home from the hospital, and now here we are again
Yeah.
back at the hospital.
And just lack of sleep.
Yeah, for both.
Yeah.
So the hospitals are trying to lower their readmission rates too, which kind of prompted this Medicare alert that we all need to work together. And Medicare released the CMS Guide program last year as a pilot, and it's a 7-year pilot program, so we're in year 2 of it now.
And what does GUIDE stand for?
GUIDE stands for Guiding and Improved Dementia Experience.
Okay.
So it is improving not just the caregiver, not just the patient, but the whole system. So the reducing readmissions, care coordination, caregiver support, support groups, keeping people safely at home as long as possible while it's safe. That's not always the best option, but usually early diagnosis, people could stay home, and they're trying to encourage that. A lot of the memory cares are full. That's another problem
And expensive.
and expensive.
And if you wanted to, if you couldn't, and you're looking to go into Medicaid, a lot of those buildings are 2 to 3, 4 year waits,
Yeah.
wait lists.
So get on the wait list now, just in
Yeah.
case you get dementia. But yes, so the GUIDE program, the reason I'm involved is because we're a caregiving agency that's partnered with the GUIDE program. So the GUIDE program is now allowing 76 hours a year. Last year it was 72. This year they upped it to 76. It's definitely not enough, but it's something. They're noticing a need for help. So Medicare's covering 76 hours of caregiver support as respite for the family caregiver. Family caregiver needs that respite, and it's okay to ask for help. Your strength and your emotional well-being are most important. And it's not only the caregiving services that GUIDE is covering. There are care coordination, so you get a care manager. So you have somebody you could talk to about what neurologist appointments we should do, what medications we should be on. Are there any support groups in my area? you have that whole person-centered approach and 24 hours access to nursing support as well.
Okay.
And this is all managed by a care management company. So Comfort Keepers cannot bill to Medicare because we're not medical.
Okay.
We're non-medical home care providers. So we partner with a couple different care management. So Lizzie Care is one of them. Pocket RN is one of them. Isaac Care. These are all just app phone-based care management companies. So they call the caregiver. They set up, the support that's needed. And you could still continue to see your regular provider. It doesn't mean you have to, but this is all covered by Medicare. And then if you do want that additional home care support, they can help you set that up. And the way you qualify for this guide program is you have to be on Medicare Part A and B.
Okay.
So no Advantage plan. Unfortunately, just because it's only Medicare, if you have an Advantage plan, even though they tell you Advantage plans cover everything Medicare covers.
No, they don't.
Yeah.
Okay.
So supplement is fine, but no Advantage. And you have a dementia diagnosis or suspected dementia diagnosis, they can help you get diagnosed as well. I work with Dr. Jennifer Stelter, and she will come out to the home and provide a full assessment and get you diagnosed so you can be approved. You cannot be on hospice care. So hospice care is typically you have been diagnosed with a disease that gives you 6 months to live.
Or longer.
Yeah, sometimes it's longer,
Yeah.
but you,
Depending on if you're declining.
yeah.
That's how you can stay on.
But if you are actively enrolled in hospice, you do not qualify for the guide program. If you were enrolled in hospice and now you're off of it, which sometimes that happens, then you would qualify.
Okay.
Palliative care is fine, and you have to be living independently. So either in your home or in an independent living community. Unfortunately, assisted living communities, they are not covering caregiver support, even though you're a very active caregiver that still needs respite. In those cases, it would all be out of pocket, private pay costs. And if you call us, we could get you applied for this guide program. So a lot of times it's somebody will say, well, go online and get this app and
We
fill
talked about
this out.
this before we went on air. That's overwhelming. You're 82 years old, you're trying to care for a spouse, and someone tells you to download an app. You're like, yeah, right. You don't know how to do it anyways, or you don't have the time. You're so overwhelmed. It's just nice if somebody could come and just do it
Yeah.
and help you.
Any load that we could take
Yes.
off of you, you're running constantly if you're the caregiver of a loved one with dementia. And when you're not running, all the files in your brain are open because you're managing your own children and family.
And work.
And your home.
Or
and
if you're the spouse,
Yeah.
and you're maybe older. It's hard. We see a lot of them that come to Memory Cafe.
Oh, yeah.
And they're in their 80s, and they're doing it on their own.
And they're struggling with their mobility.
Right.
And they're trying
And
to
their
help their
health.
loved one
Right.
in the door.
Yep.
So it's nice that some systems are getting put into place for this.
Right.
So if you call Comfort Keepers, you are under no obligation to use our services, but we can get you applied for the program. And then the care management company would call you. So you would call Comfort Keepers. I would say, what's your Medicare ID? What's your primary physician's name, phone number, and address? Your Medicare Part A and B, correct, and you're not on hospice, great. And if you have a diagnosis already, great. If not, we'll get you applied for that as well. But then I send that information to our care management company, and they would call you and set up an initial call. That initial call will be all the documents they need, all the things that they need to do, and then they do a general assessment of your loved one's condition by asking you or your loved one questions if they're able to answer. And then if approved, if you're in moderate stage dementia or more advanced is typically when you're approved. The early stages, it's a little bit more tricky. So definitely don't downplay that phone call. I know a lot of people with dementia say, oh yeah, I can get myself dressed. Oh yeah, I do that. And no, they don't. So take that call. And if you need to step away from your loved one to really tell them what's going on. And if you're approved, then the management company will help you to set up the next step. So that app-based service, they can have someone come to the home, set up that app on the loved one's phone. And
what if you don't have one of those phones?
Yeah, if you don't have a smartphone and you have a computer, you can log on through like FaceTime or a Zoom or a phone call.
Okay.
You know, so that's kind of their last. They do like to have that face-to-face, but all of it is
but
on
I don't
your
want
phone.
it to deter you from not doing it because
Right.
you're like, oh, I don't have the smartphone.
Yeah, a lot of it, or all of it's on your phone, so you don't have to go into an office. But I provide that one-on-one support. So when you're ready for home care services, our care manager, you could tell them, I would like to use Comfort Keepers or another contracted company. Your guide provider will be able to tell you who's contracted.
Okay.
I always say it's good to get 3 home care assessments. They're free. And that way, whichever one you choose, if it doesn't work out, you have one in your back pocket. I work with a lot of other home care teams, and we're all great.
Everybody gets along.
We all do the same
especially
thing.
with the triad members and all the dementia friendly.
We're here to help you.
Right.
We're not in this business to get rich.
Right.
Unfortunately.
Right. That's true.
We have a passion for
right,
it. So
we do. And that's why I like working in this group with everybody because it's phenomenal of how everybody just jumps in to help.
Yeah.
You know?
And with the guide model, it's 4-hour minimum. You could use it in 4-hour increments. And if you need additional support, like, oh, I don't know what to do with my loved one the rest of the day. Well, because I'm in these groups, I know that there's Elder Day Center. You could drop your loved one at the day center. I know that there are support groups in the community where you could bring your loved one, like Memory Cafe and things like that. So because we're also involved in this Elgin community with the Elgin Triad, with Dementia Friendly, we have resources. So it's never just a one-stop shop. Somebody's going to call me, I'm going to come to their home, and they're going to say, well, where do I get grab bars? Or where do I get this? I need a new walker. And I'll say, oh, there's a lending closet I can go to.
And over Township, even Elgin Township.
Yeah, it's just, we have so much support to offer. And that's kind of the care model that Guide is promoting, is continuum of care, continuity of care, where doctors, nurses, caregivers, outside caregivers, family caregivers, and patients are all working together for that whole person support.
And you need that because, life is getting frustrating, when everything is just hard, like with a lot of these things with the phones and the apps and the computers. It's hard as you get older. The technology and oh my God, just trying to get a new phone, and get it.
We just talked about her new phone.
Try to get
3 hours.
3 hours to get that transfer. It's insane.
Yeah.
And so I get it. People need help now, and when you get older, that's why we need you to lean on us and help. We're here to help you guys. We're the advocates for you guys.
Yeah, and there's no stigma. You don't have to be afraid to ask for help. We know that you're angry, you're frustrated, you're sad, and that's all valid feelings, especially when you have a loved one with dementia diagnosis. It's okay to ask for help. You can't do everything because you will get caregiver burnout. You will be short-tempered with your loved one and the rest of your family, and it'll affect your mental health, your physical health, and it's very important to reach out for help, even if it's not us. Like Cheri always says, I don't know everything, but I will find you somebody who does.
I do.
She's been in this industry for
25
longer.
years.
Yeah,
25
probably
years.
about the time I graduated high school.
Oh, great.
Not to rub it in.
Yeah, rub it in.
But Cheri knows everybody.
Yeah.
Everybody knows Cheri, and she is not affiliated with any agency, so you don't have to feel worried about calling her. She'll just let you know the people she knows and trusts.
And that is the big word with me, is trust.
Right. Oh, I actually tell the story of when I first joined Triad, and I said, Cheri, can I be on your radio show? And you said, it's full. And I said, forever? Well, it's full for the year. That's it. I had to earn Cheri's trust.
Yeah,
So
and it's true though. You do have to, because it's our reputation, for Elgin Township Triad and for Dementia Friendly Elgin and for me.
Yeah.
I mean, again, I worked hard for that. I've gained the respect from when I worked at Elgin Police for 18 years as the elderly service officer, and I know the seniors. A lot of them still around here in town, and if they trust you, it's important to me.
Yeah.
So yeah.
I've had that situation with even other home care agencies where we don't have caregivers in a particular area. I know the home care agencies I could lean on because I've been in these groups with them. I know their heart. I know their ethics.
Yeah.
And I'm not going to refer you to somebody who just walks in and says, "Can I be on your radio show?"
Oh, and also you think about your own personal life. I'm not going to refer somebody to you if I wouldn't use it for my own mother or my own family.
Right.
Right?
Yeah.
'Cause, yeah. Okay.
So
I think we have a break.
Okay.
I think, is that right, Dean?
Get ready.
All right.
Dream
so when we
vacation.
come back, we are going to
Go right back into it.
Yep. Okay.
And we can put our phone number out there.
Yes.
And we'll be back in just a few short moments with Cheri's Senior Moments. Thank you.
Dream Vacation Cruises International has you covered. Specializing in land and sea getaways, they're here to make your vacation unforgettable. Located at 1721 Moon Lake Boulevard in Hoffman Estates, they offer personalized service with a global network of specialists to ensure your trip is tailor-made just for you. Call today at 800-255-7447 to speak with a cruise and vacation expert. And don't miss Travel Tuesdays on WRMN AM 1410 every first Tuesday of the month from 11 to 12 p.m. on Out to Lunch. That's Cruises International. Your vacation, your way.
Hi, this is Sue with Newman's Corner Pub in Hampshire, Illinois. Are you looking for the perfect hangout spot? Swing by Newman's Corner Pub right at the corner of 72 and State Street in Hampshire. Enjoy fantastic drinks, live music, and a fun crowd that makes every visit special. Test your luck with our hot slots and our Queen of Hearts drawing every Saturday at 3 p.m. Challenge your friends to darts or pool while you're here. Newman's Corner Pub, where every day feels like a weekend. Visit us at Route 72 and State Street in Hampshire. That's Newman's Corner Pub, your new favorite spot.
My name is Ariel. I moved to the U.S. at 19. I spoke no English and I struggled finding job opportunities. Everything I have, I owe to the Adult Literacy Center and getting my high school diploma at age 22.
It was an honor helping you achieve your greatness. Now you're helping others achieve theirs. It inspires me.
When you graduate, they graduate. Find free and supportive adult education centers near you at finishyourdiploma.org. Brought to you by Dollar General Literacy Foundation and the Ad Council.
Ever tried balancing a dozen eggs in one hand while hopping on one foot? Or maybe juggling cats while riding the unicycle? Sounds ridiculous, right? But guess what? That's exactly what texting while driving is like. Your human brain only has the capacity to focus on one thing at a time. So when you're behind the wheel, give driving your undivided attention.
Don't drive distracted. A message brought to you by the National Highway Traffic Safety Administration, Project Yellow Light, and the Ad Council.
Most people out here think that taking care of one another is important. And most people would step up for a neighbor going through a tough time. Most people around here help out friends and family when they need it. But the funny thing is, most of us won't look for help when we need it. If you're struggling with mental health, you should know that there are resources out there that can help. And it's okay to talk about it if you need to. One place to get started with information is loveyourmindtoday.org. Loveyourmindtoday.org offers a range of guides, instructions, and insights for dealing with difficult situations or getting through a tough time. If you're struggling with mental health, get the help you need, because most people out here really care. Visit loveyourmindtoday.org. That's loveyourmindtoday.org. Brought to you by the Huntsman Mental Health Institute and the Ad Council.
A loved one owns a gun, and for a while now, you've been concerned about their behavior. They're just not acting like themselves. They've been distant, they've been unpredictable, they've been lashing out. They've been saying things that make you worried they might harm themselves or friends or family. Or you're worried this loved one might hurt you. Maybe they recently threatened someone with their gun. You know something needs to be done, and you wish more than anything you could hit pause on this situation. Well, here in Illinois, you can, with a firearm restraining order. In extreme cases, this order temporarily prevents a person in crisis from having a firearm, giving them time to heal before they do something dangerous or even deadly. If you are worried about a loved one in crisis who has access to a firearm, learn more about firearm restraining orders at illinois.gov/pause to heal. A public service announcement brought to you by the Illinois Department of Public Health, Brady, and the Ad Council.
Looking to set sail on your dream vacation? Cruises International has you covered. Specializing in land and sea getaways, they're here to make your vacation unforgettable. Located at 1721 Moon Lake Boulevard in Hoffman Estates, they offer personalized service with a global network of specialists to ensure your trip is tailor-made just for you. Call today at 800-255-7447 to speak with a cruise and vacation expert. And don't miss Travel Tuesdays on WRMN AM 1410 every first Tuesday of the month from 11 to 12 p.m. on Out to Lunch. That's Cruises International. Your vacation, your way.
This is
Hey, we are back. You're listening to Cheri's Senior Moments. And she got a great guest doing a wonderful job over here today with everybody. We got Heather Detterman and Cheri Eschenbrenner. Take it away, Cheri.
Pick up where we left off.
So I was just going to say, if you want to apply for the guide program,
Okay.
I can do it for you. We'll put our phone number out there. There's no obligation, but I could just get you applied, and that's 847-215-8550. 847-215-8550.
Okay.
Or even if you just had any questions, just ask for Heather D. There's 2 Heathers in our.
Oh, is
yeah.
it? Okay.
But the benefits for family, the patient being able to stay at home longer, safer environment, personalized care, and the benefit for the caregiver is the education. You get training. There are really great training videos out there on YouTube and all sorts of things, but this allows that kind of one-on-one because dementia is not one size fits all. Not everything works for every person. There are redirection techniques. There are...
Bathing.
Yeah. Oh, nobody likes to take a bath.
No.
No. Something that I do about the bath is I turn on the shower and I say, would you like to pick out your clothes first or brush your teeth first? Just giving them those options while that shower's running. And then, would you like to take off your top first or take off your pants first? And it might work, or they might say, no, I'm not taking a shower today. I already took a shower. Okay, and you know what? Something Levon Lenaway told me, get them in the shower in their clothes. They'll come off eventually. So, yeah. So that education, you'll get that one-on-one support with the guide program from a care manager and care navigation. So where do I go next? Do I take this medication? Do I see this neurologist? Do I do a brain scan to see where the tangles and webs are? What kind of dementia it is?
A lot of people I talked with said I don't know what kind my person has.
Right.
You know, and they don't. They're like, where do I start to get that test?
Yep, and that's all things that this care management can help you with. And then the way that Comfort Keepers would fit in is providing that extra respite for the caregiver. And you know what the caregivers usually tell me when I say, well, you've got these 76 respite hours. How would you like to use them? Well, I don't really know. I don't really go anywhere. Well, now you can.
Right. Go get your hair done.
Right.
Go out to lunch with a friend.
Yes. Or even go sit in the bathtub, if you could still get in the bathtub. But, just having that time to just shut your brain off for a few minutes and know that your loved one is safe. So Comfort Keepers provides the personal care. So if they're having incontinence issues, bathing issues, getting dressed, and what Comfort Keepers does is we do things with somebody as much as they can rather than for them. So we want the person with dementia to still be independent, still live their life. You don't need to talk to them like they're a baby and they're there, let's change you and come here, honey. No, they're still an adult. They deserve to be treated with dignity and respect and have a say in their day-to-day and make decisions that are safe and appropriate. And our caregivers are trained on dementia-specific techniques that will help with difficult behaviors. And another Levon Lenaway quote, they're not giving you a difficult time, they're having a difficult time.
And then you've met one person with dementia, you've met one person with
That's
dementia.
right, that's
Every
right.
single person is so different.
And our caregivers will also give you time to get your house cleaned. We could do light housekeeping, do laundry, fall prevention.
Do you have minimum hours for comfort keepers?
We do. So it's a 4-hour minimum. And with
Per
this
day?
per day.
Okay. What about a week?
A week, we like to do 3 days a week at 4 hours each, just for that continuity of care. But with this guide program, there is no weekly minimum.
Okay.
So you could just do the 4 hours once a week if
Okay.
you wanted to.
That's good to know.
You can do up to 12 hours a day with the guide program. So 4-hour increments. If you wanted somebody overnight, I know a lot of the times challenges are, I can't sleep because he's up wandering around and trying to leave the house. Get that overnight caregiver in and put your spouse in another room. It's okay. Get yourself some rest. And but with Comfort Keepers in general, aside from the guide program, we do accept long-term care insurance and helping you navigate. That's a whole nother maze. But long-term care insurance does cover home care. We also accept veteran benefits. So if you are a veteran and you are in need of assistance or the spouse of a veteran, please call the VA. They'll do an assessment, approve you for so many hours, and then they can fax us the referral. Now, if it's private pay with Comfort Keepers, then I will be your contact person. I'll come out and do the assessment. We come up with a person-centered plan of care. Even with the guide program, I'll be your main
What is your
contact.
area? Your Elgin, South Elgin? What do you do, Heather?
Oh, goodness. I am from Oswego all the way up to Woodstock.
Okay.
But we have 7 office locations.
Okay.
I'm just out of the Elgin office. So as far as me being your point person, I've got a huge territory, but we do have some really great partners in our other offices. David and Amel and Patricia, they would love to be able to come out and help. We service Chicagoland area, so Cook, Kane, Lake, DuPage, and McHenry counties are all under our franchise.
Okay.
Comfort Keepers franchise has been around for 26 years, and our owners have had it, inherited it from their mother over 20 years ago. And yeah, so we're everywhere.
Yeah, I know that one of the cases that I had referred with you is one of my friends that I used to work with, her uncle. I mean, that was a live-in.
That was a live-in.
Yeah.
And
you do those too.
yeah,
That was a challenge.
the family wanted to keep their uncle at home. That was his wish. And our live-in caregivers provided that support for the nieces.
And when you say live-in, do they get a new one every 8 hours?
So a live-in would be 24 hours a day, 5 days a week. The same person is in your home.
Oh, same person, okay.
And then the additional 2 days, it's another person there. So they need a place to sleep in your home and have that downtime. If you're a caregiver who your loved one is wandering at night, a live-in caregiver wouldn't be right for you because they need that sleep at night because they're working all day then. So then you would have probably 16 hours during the day and 16 hours at night.
Okay.
Now, all of those big hours would be either out of pocket or long-term care insurance.
Okay.
So Medicare's only doing this 4-hour increments.
Okay.
Oh, and that's another important part. So it resets every July.
Okay.
So July 1st through June 30th,
Okay.
you can use those 76 hours of caregiving services however you want. Again, you will still have your care manager. The 76 hours is only limited to the home care payment. So you can still pay out of pocket for caregiving services if you wanted to. In addition, a lot of my clients that already receive private pay services, now I'm telling them about this program, getting them signed up, so they have an additional, a little help with their pocketbook. But yeah, back to that live-in case, it might have been time for that person to go to a community, and family just
Couldn't do it.
they just couldn't do it.
Yeah.
And they were at the house a lot, even though we had a caregiver there. We had a lot of, difficult behaviors and things that aren't always manageable in the home, such as leaving the home or using the stairs, things that communities are better suited for. So I never want anyone to shy away from a community if it's the right fit for you. Some people can stay at home through their whole journey with dementia. Some people, it's no longer safe and it's no longer healthy for you, the spouse. So when I have a family with us, they've got early onset dementia. They're just a little forgetful, maybe need some prompting throughout the day. I can do that. And then every 90 days, I do a reassessment. And I might say, wow, wife, you look really tired. This might be time to start looking at communities, and we have people that can help you with that too. But never be ashamed to ask for help. You are not alone. There is so much support available now.
And it's talked about now. Before, no one would say the D word.
No?
No one would say dementia. No one would even take a piece of paper that had the word on it because
Right.
they thought they might catch it.
Yeah.
It was that stigma was so bad. And now, I mean, we talk about it so much. We have a whole show on this every month. I think it helps because it's bringing the people out now. Can't help you if we don't know.
Right.
So you have to tell us, and we can help you. And again, you don't have to feel embarrassed about it.
No. And even if you are the person with dementia, well, my doctor told me I have this. I feel okay right now.
Right.
What should I do? There is planning that needs to take place, as far like Taylor Spooner can help with the legal things. So, getting a power of attorney.
And get it signed while you still can.
Right.
Once you get a little too far along in dementia, they're not going to let you sign power of attorneys and different things. So you got to get that done now.
And if you don't have adult children, then the state comes in and becomes the guardian and takes over, which sometimes works and sometimes doesn't.
Right.
But yeah, early detection is really, really important just to get all those documents in place. And hey, maybe I'll start looking at communities now. Maybe I'll never need it.
But you know what? It wouldn't hurt because when you're in crisis mode, that's the worst.
Yeah.
And now they're full.
Right.
Or you can't get into the one you thought you wanted. So maybe even if there's a waiting list, get on it.
Right.
When your name comes up, if you're not ready, you pass.
Yeah.
But at least you're on it.
Yeah, absolutely. That's something that I see a lot, memory cares being full because there is just such a need. So home care support is usually people's first stop, and that's what I'm here
And
for.
I also wanted to make sure, too, because of Dementia Friendly and our Memory Cafe, Detective Chad Benavides with Elgin Police comes to our meetings quite often, and he often reminds everybody again that there's the Family Finder program at Elgin Police Department. So if your person tends to wander, they really need to be in that because they will come out, they'll take a picture of them, a recent photo, get some emergency contact information because if they did go out that door, seconds count, because they don't know where they're at. And a lot of times the weather, they don't feel the cold or the heat or they're out there in their, just no shoes. And so if their picture is in the Family Finder, then that gets sent out to every squad and then that's on the beat and in the street and everybody can start looking.
Yeah.
So it's important that think about that. And every police department does have such a thing. Elgin's called Family Finder. We started that in 2008 when I was there. But South Elgin has it. Dundee has it. Everybody has their own name for that program, but reach out to your local police department and just get them put into that system.
And even so they know that this person has a brain disease and is not impaired by drugs or alcohol. My concern is always the wanderer that is also exhibiting some aggressive type behaviors. What do the police do? They're going to think, oh, this person's going to attack me. I have to protect myself. So that's why Cheri provides training for them as well. But just having your name and picture on file, not even just to find you, but just to identify, oh, this is a person that is experiencing this brain disease. They're not, on drugs or meaning to try to attack me.
Right. And Glenna and I, from Dementia Friendly Elgin area, we have gone out and do several trainings to Elgin Police and the Elgin Fire Explorers. And that was fascinating. I mean, those kids really were into it. It was really good to see. But we do any training. It's free. It's like a 20-minute to a 30-minute training to any group.
And just coming to Memory Cafe with your loved one, if your loved one's still able to come out, we have so many people there to support you to get in, to get seated, to get food, have a night off from cooking.
Yep.
All of us that are on the advisory council are in this senior care space. So we will hold the door. We'll help you get your loved one to your car. A lot of times first responders are there in case there's a medical emergency. So it's a safe place to come to Memory Cafe. We have pizza. Usually it's pizza, dessert.
But it's fun because you don't have to worry about anybody looking at you and thinking what they're thinking because we're all there for the same reason. We all get it. And a lot of these, what I find fascinating is our dementia-friendly Elgin area council members, their family member had it.
Right.
So that's why we're there too, because we're trying to give back.
Yeah, and we all come up and introduce ourselves and let you know our journey, that we're there for you. And it's nice to be able to talk to other people that are going through the same thing. A lot of times people get isolated. Well, my loved one has dementia. We can't leave the house. It's a nightmare. It's more
And
exhausting.
it's lonely. It's very lonely.
Yeah, all of a sudden,
You have no friends anymore.
your friends aren't inviting you anymore because you've had to say no so many times that they just stopped. So even now that you have this respite time, you've got no one to call.
Right.
So go meet some like-minded people and ask for help.
And what's funny about even with our Memory Cafe, some of their spouses have gone into a memory care or they've passed. They still come.
Yeah, you're still the caregiver.
Because you know what? You've made some friends now there, and you get it. And again, it makes you feel, you like to hang with the people because they get you and they understand it.
Yeah. It's not only for AA. Support groups are for a lot of different things.
Yeah.
And having that community is really important. But the key takeaway for me, the guide model is used to improve the dementia care that caregivers and patients receive. Primary goal is collaboration, that collaboration of care between your physician, between your nurse, your caregiver, home health, PT. Let's all get on the same page under a care manager covered by Medicare Part A and B. And if you have any questions or you'd like to apply, you can call me at 847-215-8550. Ask for Heather D. Or
dog.
You can call Cheri. But getting on this guide model program, at least you always have a care manager. You have someone to say, what do I do? Like I always say, well, call Cheri.
Yeah.
But if you don't know Cheri, you have that person.
And then if you want to get on that email list too, it's DFE. So like it's for dementia friendly Elgin. So DFE list, LIST, DFE list at gmail.com. That comes right to me. I'm monitoring that email list and I add you. And then again, maybe you don't have a question today, maybe tomorrow, whatever, or you get somebody a week, 2 weeks from now, call me, email me, and we'll get back to you right away. That's another thing. When I get emails and phone calls, you get it the same day response. I'll tell you that.
Yeah.
Because you know what? I put myself in that spot, and I know how I feel when you call somebody and they don't call you back, or it's 2 and 3 days. That's not helpful.
Or you've got an automated voice system.
And what's even more refreshing, the thing that you said, if you don't know the answer, I'm going to get back to you.
I will get you it.
Yeah.
And we will find out what's going on for you. The community is lucky to have both of you. Cheri, seriously, you've done so many great things for many years. We're not going to count the years, although Heather tried to bring that up on you, but that's okay.
Yeah.
Very seriously, though, to have you two ladies out here and to provide this, there's no shame in dementia. There's no shame whatsoever. It's good that you folks are out there. Cheri, you could reach her at any time at 847-468-4168, 847-468-4168. And then if you want Heather D, that's real simple. She's 847-215-8550.
I'd like to give a shout out to Brendan. Hi, Brendan.
Hey, that's our guy. He's WRMN's number one fan. And
whenever I'm on YouTube, I see him. Hi, Heather.
Yeah, that's our buddy. And again, if you want to get on the email list, it's real important, this stuff that we're talking about. The email list is dfelist@gmail.com.
Nice and easy.
dfelist@gmail.com. Every one of these shows are archived on what's called the YouTube. Now, you could hear it live because you rebroadcast again later in the
At
day.
2 o'clock today.
So That's one source. But like, say if you missed a phone number or you missed what they said, you go to the YouTube, you could rewind it, and you could play it. You could, these flyers that I was putting on periodically, and I'm going to do it one more time because we're about toward the end. But it's very important that you get this information. Cheri goes to great lengths to get this information to everybody. Take heed of it. It's there for you.
Yeah.
And Cheri sends the YouTube link.
I do.
Which makes it easier.
So after this show, I'll ask Dean to send me the link, and then everybody that's on my email list right now is 351. I will send you that link. So I know it's easier for you to just click on that one thing, one link, and then you can watch the show.
And she can send you information on what the partners are doing. Yes. So because she doesn't share your information with me, if I'm doing an event, I could say, here, Cheri, can you share this flyer about my event?
Yep.
And confidentiality, don't take it light. Another job I have, I work for a law firm as well. It is very important. Not just because, that HIPAA stuff, that's whatever. It's just you want to build trust with somebody. Right. The only way you trust, like if I say, hey, you know what, Heather, I got to tell you something. If I know I'm going to talk to Heather, I'm going to have a secret with her.
Right.
I'm going to talk to her.
Right.
But if I know Heather's going to go, hey, did you believe that, Cheri?
Or
you guys don't do
other people call you from that conversation.
You don't need that.
Oh, yeah.
You want to know that, what you have to say, number one, is important, but more importantly, it's going to be addressed and that it's confidential. Because sometimes people are, embarrassed by it.
Yep.
And that memory screening that you just had up there, that's another really important thing. This is not broadcasted or advertised or go to your doctor unless you bring it to them.
Yep.
And the Alzheimer's Association fought for a bill that would allow privacy with pre-screening, and that bill was passed. Okay. So if you do get pre-screened for dementia, outside of our little screening, if you go to the doctor, get a brain scan, your insurance company does not have access to that pre-screening.
Okay. And the last chime in I do have on that, it's very important to make sure that get your affairs in order now.
Yes.
Because if you want a power of attorney, and remember, powers of attorney are only valid while you're alive. Once the person passes away, so does that power of attorney. So get your wills, make sure you have a trust, put things in order. If you're up in the years, sometimes it's good to re-look at that and revisit because people move, names change, people pass away, beneficiaries that you have.
Or you might not like that family member anymore.
And that happens too.
It does.
You want someone to take care of you and respect your wishes.
Yep.
So,
all good.
There you go.
Absolutely.
Very nice to have you both on here.
Thank you so much.
Heather Detterman was here today, along with, of course, Cheri Aschenbrenner, each and every second Thursday of the month. And we will get that link out to everybody. Thank you. We'll see you next week.
Okay,
thanks, Cheri.